disorder, much as you would do with fluoride. They're less likely to develop a disorder.
And you work with, obviously, a school system or education professionals who work with a very young child, and that's happening younger and younger over the last 20 years, in that schooling is now 3 and 4 and 5. Preschool becomes younger and younger. So you work with education professionals to be able to at least be able to read behavior.
Correct, exactly. And also how to structure an environment so that it promotes positive development.
I love that you talk about resilience and preventive care, that early intervention, and again, those are words that we're so sort of flip about, but knowing that it's time for a professional's help can create a whole child and then a whole adult with care.
Exactly, and that's really what we try to put forward, but also even when a disorder develops, we're still looking at prevention and preventing complications, and again, getting the child's development and the whole family's back on track, because it's really devastating to a family when there's a child that really has a difficulty.
Right. It affects everybody.
It affects everybody.
And can change an entire family unit, and everybody knows that too. We're going to talk later in the program about some issues in terms of adolescent behavior and again self-injury and eating disorders. But let's talk a little bit more about early diagnosis, or what would be some symptoms that would make a parent say, I think this might be beyond me.
Right. I think what's really important in that situation is to be very open listening to teachers, to the school, because we talk with many, many teachers and who really try to figure out how can I get across to the parent that this really is something which requires attention.
It may be more than disruptive behavior in a classroom. You know, depression in girls might take a different sort of behavior mode, and it wouldn't be disruptive ordinarily.
Correct. We're not talking just about disruption.
Right.
It does turn out that the boys are more disruptive.
Yes.
And
Which
we
is
see
not, by any measure.
Well, but actually it does reflect referral patterns, because for boys and men, the referral pattern is usually the other person. So when it's your boy, the referral pattern is going to be the parent. Girls are more readily will come forward because they do have more internalizing disorders, that they feel anxious, feel depressed, and are willing to admit it. And so, and that's why also in adulthood you'll see more women seeking care. Unfortunately, the way our system is set up, a lot of the men are not referred and end up in prisons. And we see a lot of statistics that the largest mental health facility in the country is the California prison system.
That's been talked about for years. Is that something that, you know, where does the fix come from for that? You know, what would make a state or a community aware that a great preponderance of people who are incarcerated have a mental illness?
It's going to require a lot of education. You know, it's ironic that actually it costs more to incarcerate somebody than it does to treat a person. But it does require an understanding of people and changing one's ability to be open to what it is that's really occurring.
And that's public policy.
Correct.
Which is a whole nother topic.
Yes.
And we're not going to talk about public policy today, but we are going to talk about children and adolescents, anxiety and depression. And we're going to take a short break right now and come back with Dr. Gary Spivack, child psychiatrist, and more. Don't go away. We've got another great portion of the show for you. We want to tell you again that this is brought to you because HCA, the Hospital Corporation of America, feels that public education is critical to all of our well-being as a society. HCA is the owner of Reston Hospital here in Virginia, in Reston, and the Fairfax and Reston Surgery Centers. And they're also involved in projects that aren't built yet, but are in the pipeline, as we say, in Broadlands, Spotsylvania, and the Stone Spring facility on Route 50. So don't go away, stay with us. This is Health Focus, and we'll be right back. Hi, and welcome back to Health Focus. Again, I'm Ann Rodriguez, your host. And we're so fortunate to have with us Dr. Gary Spivack, who is a child psychiatrist, and you work in disorders of mental disorders with children and adolescents, and you do some adult work too.
Correct.
Yeah. And you're affiliated with the Columbia Associates in Psychiatry and Dominion Hospital in Mindshape. We were going to talk a little bit about adolescence and self-injury and eating disorders, both of which burst on the popular scene 10, 15 years ago. Certainly longer in terms of eating disorders, and we've learned a lot as it's become a more public discussion.
Exactly. And we've learned really what's behind those disorders and then how to address them, how to treat them. There's a tremendous amount that has to do with a person feeling overwhelmed and wanting to get back in control. And unfortunately, the ways of being in control end up being hurtful to oneself, even to the point with the eating disorders where you can die.
Where you can die. Explain this a little bit more. It's about control, and it involves the entire family unit. Dynamics may be set in place a long time ago, and then the manifestation are some horrible things. How does that happen?
Well, you've summarized it pretty well.
Oh, that's your job.
No, that was excellent.
I'm embarrassed.
But you're right. We're talking about, particularly with the eating disorders, that having to do a lot around anxiety, and then the inability to establish a stable sense of oneself. And so a person is struggling with that. And oftentimes these people are very bright. The families are very bright, high achieving.
Actually, the demographics are, for the most part, Caucasian gals, high achievers already.
Exactly. And so there's really a lot of emphasis put upon achievement and perfection. Mm-hmm. And so for a lot of these girls are very perfectionistic. They take it to an extreme and find it particularly becomes a difficulty when adolescence hits, because there's all this onrush of change and confusion, and that becomes unacceptable because they want things to stay the same and really don't want to go through the changes that are brought about by adolescence.
And then the behavior that's manifested is so serious. When does it become, I'm stressed, I'm anxious, this is a high-performing area, a lot of schoolwork, certainly in middle school and high school, it's about the social life. When does it become something that just needs to be thought about, analyzed with a parent, and something so serious that it requires an intervention on the part of the medical team?
Right. Well, I think, again, this would be something that when a parent has any concerns, would be a good idea to talk with the pediatrician, because they're very good guides and they really, have a lot of experience. But it has to do with whether or not the direction that is going in. When you see things that are temporary phase, if it's for a couple of months, 4 months, 5 months, okay. But when it starts to go on longer than that, and you're seeing a direction where the child's growth is being affected, particularly, with anorexia, right, or with bulimia, where you're looking at a child doing things that are actually harmful to themselves by vomiting. These, we already know that people draw the line, really wait too long. So if you're worried about it, you should really get it looked into.
We should also mention your website too, because so many of us get that early information, through websites. So talk about your website.
That's
and
true.
Certainly give the location.
Right, and it's at www.PediaPsych.com. That's PediaPsych.com.
PediaPsych.com.
Right, and we're trying to do that. We're putting more and more information on it. There's a lot of information about anxiety. There'll be information on the eating disorders, on self-injury. And we really try to organize care in such a way that works out for people with these disorders as well, so that we have dietitians, psychologists, social workers, and psychiatrists all within the same practice to really make it more a center that you can go to and get help with all the different aspects, because life is rather hectic, and so when you go around to all different places to address the complexities of disorder, it gets a little difficult, and so we really try to make that easier for people.